So exercise is really, really important. 20 minutes every day. So people who are diabetics usually are overweight, they eat too much junk food, and they don't exercise. So all of you in this room right now, you should be exercising at least 20 minutes every day. Now when I say exercise, I'm not talking about just aerobic exercise where you're walking. This is not about patty cake. This is about getting some weights. This is about getting some elastic bands, because you want your muscle to burn the extra fat or extra glucose, extra sugar in your body. So that's the whole purpose of exercise. You know what we exercise in America today? Our thumbs. That's it. For the TV remote. But most people, and I read an article about, we go from chair to chair. We go from our car, chair, it's chair to chair to chair to chair. Okay. Obesity and diabetics. Most diabetics, like I mentioned, are overweight, but not all overweight people become diabetics. The reason we have an issue is when you're overweight, your pancreas has to work harder. Let me tell you what happens in your body. When you eat food, your pancreas makes insulin to put glucose in cells. I'll say that again. Your pancreas makes insulin to put glucose in cells. So let's just say that you've been really eating a lot of food. There are people that eat a lot of food. I had one patient, little side note, that was recently on vacation in the Carolinas. He went to Hilton Head, and he made a decision. He was on vacation, and he was just going to eat with what I like to call reckless abandonment. In other words, he ate whatever he wanted to for a week. His wife was furious with him. Well, on the last day, they must have had a birthday party for all the grandkids, and he looked at me afterwards. We had some conversation. He said, what was I supposed to do with my grandkids? This guy ate so much sugar, and I believe what happened to him, he ended up getting a heart attack. Because the sugar depleted all the minerals out of his body. I mean, he ate a lot of sugar. Now, I don't know if any of you have ever been on a cruise or not, but in a cruise week, you could gain 10 or 12 pounds. I'm sure that guy gained 10 or 12 pounds that week. But the sugar created lactic acid in his body. He ended up having a heart attack. But I said to him, I said, you know what, I've been to birthday parties. I don't eat the cake. I don't eat the ice cream. I don't make a big deal about it. I just smile. You smile. They learn after a while that you don't eat sugar, so they don't even ask you anymore. But in his case, he had 13 grandchildren. 13. If he would have died, he would have had a lot of unhappy grandchildren. And he just dropped his head down, and he just said, I know that was a part of the problem. So his body had to produce so much insulin. You get most of what I'm going to say to you. This is really important. Insulin causes inflammation. Inflammation in the body. Inflammation of blood vessels. So if you eat sugar a lot, you're going to have pain in your body. But what happens after a while is all the cells get filled up. So insulin, food comes in, insulin is secreted from the pancreas, it grabs glucose, which is blood sugar by the hand, it walks it to a cell, knocks on the door and says, hey, have some glucose. Opens up the door, insulin pushes it in. Well, after a while, and I know that most of you can have a testimony to this, people's cells are so filled up today that the insulin doesn't know what to do with it, and guess what happens to people? They're getting bigger and bigger and bigger, and it finally comes to the point where the pancreas says, I'm done, I'm exhausted. So your blood sugar goes from 100 to 110 to 120, you go to see your doctor, he says to you, you have a touch of diabetes, he gives you actose, glucophage, or diabinase, and I told you at the beginning of the program, that's slapping your pancreas to beat the you-know-what out of it one last time before you have to be putting on insulin for the rest of your life. So here's what you need to do. If you don't want to become a diabetic, you don't eat sugar. That means you don't go to McDonald's and get a triple thick shake. You start looking at labels and seeing how many grams of sugar are in items. When you go to birthday parties, you just smile. So most people know what their problem is, but they don't really know how serious it is, because I've had people that put insulin in their belly and they have insulin pumps and they get, you don't want gangrene on your toes, okay? So as I mentioned to you, with the food that you eat, insulin opens up doors, and after a while there's no doors to put the insulin or the glucose in. There's not even enough fat cells to put the glucose in. Insulin resistance. Insulin resistance is when cells just are not capable to respond anymore. Now, I mentioned to you earlier a little bit about liver gallbladder. I want you to listen to me. I want you to go to the bottom of the page where it talks about our treatment plan. We have an herb that we use called gymnema. Gymnema takes away the taste for sweets. Gymnema. Diaplex is the product that we use in our practice It's kind of like chiropractic diabetes, but it has pancreas tissue in it, it has liver tissue in it, it has thymus tissue in it. It's a support for your pancreas. The next one is coleus. Coleus is an herb we use to build muscle in your body. The next two items, inositol and choline, are designed to improve fat metabolism. And you'll see where I'm going with this in a moment. Pancreatrophin happens to be pancreas tissue. It's called a protomorphogen. So the whole theory is if you take an animal tissue and you put it in your body, the nucleic acids will allow that body to grow and be healthy. Now I want you to listen to me because this is really significant what I'm going to share with you right now. People who've had their gallbladder out, getting your gallbladder out is not healthy. Your gallbladder is right here. Your gallbladder is your reservoir. It's kind of like your detergent in your body. Your gallbladder, your soap. We call it, it's an emulsifier. When your gallbladder is out, you can't emulsify fat. Now listen to me. If you have a glucose molecule and you don't have a gallbladder, or you don't have a good functioning liver that's not producing enough bile, there's literally a layer of fat around glucose in your body. So you're the kind of person that's always craving sugar because your body doesn't realize that you have glucose available because there's a layer of fat around it. That's why we encourage our patients who have had their gallbladders out to take a product called Colocol. So what I'm going to say to all of you, if you have a craving for sugar, and you've used chromium, chromium takes away the taste for sugar. I'm sorry, the desire for sugar. Gymnema takes away the taste of sugar. If those haven't worked for you, we use a product called whole food bile salts or Colocol. Listen to me how you take it. You take one a day. The next day 2, the next day 3, and you go back to 1. That's why I encourage our patients to eat apple, beets, and carrots. Why? Because you want your liver functioning optimally. Why? To secrete bile. Why? To take the fat off the glucose. Why? So your body recognizes that you have blood sugar available. You know, back in the old days, can you believe this? I used to eat fast food. I used to go to Burger King and get a Whopper with extra mayo, large order fries, and a Diet Coke like everybody else. And I would get done eating that Whopper like so many people today, and guess what I was? Hungry. And guess what I wanted? Another Whopper. Because it's dead and it's useless food. And I used to drink alcohol and did a lot of stuff that a lot of other people do. My liver and my gallbladder wasn't functioning optimally. If you crave sweets, what's going to happen to you is your body's not burning the energy properly inside of you. That's why we encourage hair analysis. It tells me a lot of what's going on. If you're craving sweets, you have poor energy metabolism, you know what your body's going to start burning? Your muscle. So you end up getting what we call the Humpty Dumpty body. The big old belly and the little spindle arms and the little spindle legs. What's going on is your body has burnt all your muscle. You want muscle to burn the extra glucose. You see where I'm going with this? So you want to make sure that you're eating enough protein. Everybody in this room that's listening to me right now should be eating 3 to 5 ounce servings of protein with each meal. I do diet sheets on everybody. I've done tens of thousands of diet sheets. And guess what people don't eat enough of? Protein. Guess what everybody loves to have? Cereal with milk. Whole wheat toast with jelly. Pancakes with syrup. And then everybody always puts whole wheat everything. It's not about the whole wheat. Whole wheat can cause challenges inside of your body also. So, insulin resistance. We talked briefly about glucophage, diabetes, and let's say actose. What those items are doing to you, those items are beating your pancreas to death. Does that make sense to you? I hope that you got that by now. So we use an herb called Gymnema. Gymnema will rebuild pancreas cells. That's a little nugget I want to throw out to you today. Gymnema will rebuild pancreas cells. That's really significant, the Gymnema. Okay, what you don't want is a fatty liver. Because if your liver is fat, it's not going to be able to make enough bile. That's also really important. If you had your gallbladder out, you want to make sure that you're taking some Colocol. We have another product called AF Beta Food. The biggest complication that happens when someone's a diabetic is that they lose blood flow. Their body stops moving the blood like it's supposed to. Okay? And then you can shut it off.